Hi, this is Dr. Nina Naidu. I'm a board-certified plastic surgeon in New York City, and today I want to talk to you about the tuberous breast deformity. This is something that I see a fair amount of in my practice, and I just wanted to explain it because it's so confusing to patients. And this is what's going on. So this is a regular breast, nice, round, normal shape. And what's happened during your development is that at the time of puberty, here's your breast bud, your breast tissue starts to grow concentrically. It starts to grow outwards in all directions to form a nice round mound, nice round breast shape in most cases. With the tuberous breast, what's happened is that your breast tissue will grow up, but there's a constricting band here, or there are some constricting fibers, so it doesn't grow in this downward position. This doesn't happen. So what happens instead is that the areola becomes enlarged very often, and the tissue tends to herniate out through this weakened point. So you have tissue up at the top of the breast, you have a large areola, and you have nothing at the bottom. And when you look at the width of the breast, if you remember in a previous video I talked about the base width of the breast being the most important measurement for breast augmentation. This is our width in our normal breast, and in our shortened breast you can see that it's much less. And that's very typical of tuberous breasts. So what happens when we look at them from the side, or in this case from an oblique angle, we have the nice mound of the regular breast, which has developed normally. And what's happened in the tuberous breast? We have no development down here. So we have our large areola with tissue that's herniated, basically herniated through it, and we have the growth up here, but nothing inferiorly. So it gives this kind of tubular or tuberous form, which is why it has the name tuberous breast deformity. When you're correcting a tuberous breast deformity, it's very important that you just don't put in an implant and try to fill the space that way, because what happens is that you have basically a large mound up here and the breast tissue just hangs off of it. And I've seen that, and unfortunately when patients come into me and they've had it done elsewhere, I do see that happen. The most important thing to do in these cases is to open up this tissue. We want to open up this tight space, really release it, and then when you put an implant in, it'll allow that tissue to fill out and you'll have a more normal shape to the breast. So that's just a very brief presentation on tuberous breast deformity. I do have a little section on this on my website. You can go to www.naiduplasticsurgery.com. As always, thank you for watching, and please subscribe.